Hello viewers, this is Dr. Singh reporting live from DS Studios. I welcome you once again to Vector Clinic, and today's session is on PCOD treatment and the various options that are available to you. In this video, I wanted to specifically bring up PCOD because it is the PCOD awareness month, this month of September. So I thought it would be wise to bring up a topic that is of maximum concern when we talk about women health and also the hormonal imbalances which we are seeing a more rampant increase these days. It's probably because of the lifestyle changes that have occurred. Now, one of the mainstays of treatment of PCOD is in the lifestyle modifications. Like I mentioned here, weight loss, healthy food, exercise, sleep, quit smoking, and reduce stress. These are the general recommendations that any person on a PCOD needs to employ. Now, taking medicines alone is not going to help you because you need a combination of these two. The combination of lifestyle modifications and also your medicines are absolutely important. Now, if you are someone who is already suffering with PCOD, you already know what the symptoms are. The symptoms such as you have weight gain, you have facial hair, you have male pattern of baldness, acne, so many other things, along with menstrual irregularities and inability to conceive. All of these things are combined in PCOD, and the central and the most problematic thing here is the increase in male hormone. So the male hormone needs to go down. The next likely question and the most logical question is, why did the male hormone go up? The most important thing to remember, the reason why the male hormone goes up is because of the insulin. Now, insulin goes up when you eat too much of sugar, you eat too much of carbohydrates. All of these things are related. So it would make sense. It is completely a logical choice that in order to reverse the PCOD, you need to do weight loss. How would you do weight loss? You first begin by reducing your carbohydrates in your diet, you reduce your sugars in your diet. These two strategies have been proven to be the most effective. I would even go the distance to say that weight loss and diet modification and your lifestyle modifications are more important than medicines itself. So if you are someone who who has tried various medications in the past for PCOD and you have not seen much results, then I can tell you, if you combine your current medication along with the strategies that are mentioned here, you are in complete a situation where you're going to see results very, very soon. Now, you must be wondering what these are. I'll come to these a little later. I'll tell you what they are. Now, if you have PCOD and if you're wondering what's the next step, you go to a gynecologist. And then once you go there, your gynecologist is going to ask you the same set of questions. Since when are you having this problem? What are your symptoms? And once they have all the symptoms written on a page, you'd understand which side you are on PCOD. PCOD also has a different levels of severity. Say if you're mild, if you're moderate or severe, regardless, you are going to have all of these tests done. The number one test is to understand how the connection between your brain and your ovaries is. So to know that, you're going to get a FSH and LH test done. This is going to give you an idea of how the relationship is. Followed by lipid profile. This is going to give you a general idea of how the lipids are in your body, how the fats are in your blood. So it gives a good idea of where you stand. Then GTT and fasting insulin. These are very powerful tests. These are going to tell you how your level of insulins are currently. So say if your insulin levels are too high, then you are having something called as insulin resistance, and that is the single most biggest risk factor for developing PCOD. So for all of these results, you have a specific fix, and it also tells your physician what kind of medications you would require for your particular case. Every person is different. Every person requires a different strategy of treatment. Ultrasound is another test that is going to tell you, it's going to show you how your ovaries are. It's without cutting open your body. The ultrasound is just a scan. It's just put on your body with a little gel, and then you understand how the current situation is inside. So all of these tests are done on an empty stomach. Remember, when you go for these tests, you're not going to eat anything, and you're just going to show up at the diagnostic center, and they're going to draw a blood sample, and then that's about it. You'll get your results in a day or two. Next, once we decide on what kind of a problem you have, you're going to move on to the strategies for treatment. Number one is weight loss. Then you're going to eat healthy food. Now, healthy food mein kya hai? What is that? I mean, it's just like saying go eat something nice. It doesn't end there. You have to give us some answers. So healthy food is reducing the carbohydrate intake. What are carbohydrates? Rice, roti, chawal, whatever that is easy to eat, what we generally eat, idli, dosa, all of these things are high in carbohydrates. Once you strategically reduce this, say if you're eating one portion, reduce it to half, then after a week reduce it to 1/4 of that. Then what are you going to do? Once this 1/4, 3/4 are reduced, what are you going to do with the rest of the 3/4? You're going to put high quality protein in it. Protein like eggs, you can have a little more of meats. These two are going to replace the vacuum that you have created by reducing your carbohydrates. That's how you manage your food. So once you start doing that over a period of 4 weeks, you're going to start seeing some change in your midsection of fat. Midsection fat jab kam hoga, your insulin resistance will improve. It's going to go down. It is going to be more effective. Now, say you have started doing this, you have started doing your exercise, you are sleeping well for 6 to 8 hours, you have quit smoking, and you are managing your stress efficiently. Despite of that, you're not seeing results. Then that is the situation when you will have to consider some medications to aid the healing process. This is only there to aid your body. This is not there to fix the problems. To fix the problems, you have to employ your lifestyle modifications, but to aid your body in healing itself, you have to take some medication. So these two things, it's very important to understand and not blame medicines and just dump all your capsules out and just say, I'm going to do it naturally. You're bound to fail sometimes. You can achieve it, but it's going to take a long time. You're going to have the burden of the disease. So pay attention that OCPs are safe when they are administered by your physician. The physicians are going to take a look at your entire profile, your situation, and give you the dose that is required for you. So OCPs, really important. Then metformin. Metformin is a medicine that has been there for a very, very long time in the world of diabetes. What it does is it increases the body's sensitivity to the insulin that you already have. It's not going to make your body produce too much insulin, because the main role of metformin is that what insulin your body is producing is going to be more effective from then on. So metformin, again, another option. Myoinositol is another drug that has been there in the market, but it's not very well established as of yet. Then you have a surgical option, which is ovarian drilling. Ovarian drilling mein, there's a small surgical procedure with a small probe. They go inside, go up to the ovary with the camera. They're going to punch small holes into it with very low energy, about 6 to 8 holes in each ovary, and thereby your eggs are going to start coming out. The real problem in PCOD sometimes is that the eggs are not able to come out, and then they start producing a lot of male hormone. So once the eggs start coming out, your ability to conceive, the ability to have children increases. So this is an option considered for women who want to have children in the later part of their reproductive life. So I hope this gives you a little idea. Now pay attention to this. Obesity causes PCOD and not PCOD causing obesity. This is an important concept that you need to pay attention, because a lot of women I've seen, you blame your weight gain because of PCOD. It's not like that. It's often that your weight gain has created a situation of PCOD. So the strategy remains, it is very central that you reduce your weight by doing weight loss, healthy food, exercise, sleep, and all of those things packed together. Now, as I wanted to talk to you about these two things that are in my hands, this is vitamin E. Really powerful antioxidant. It does two things. Ek to it can reduce a lot of your oxidative stress, like if you're a smoker, if you've been in pollution out there, if you have a lot of toxins in your body and your skin is not glowing, you're having some hair loss and so many other things related to toxins. this is going to effectively reduce it. Vitamin E, there is a groundbreaking research on this, a lot of research which shows that it reduces the male hormone as well. It's a perfect antioxidant in situation of PCOD. It's going to reduce it dramatically, and do this for about 2 months. You take 200 to 400 milligrams depending on your situation. You're going to see a lot of results. Another one is a general antioxidant. This is for your skin, nail and hair. So these two things are going to improve the skin quality and also the effectiveness of your medication, and also what hard work you're putting in to improve the quality of life. These things are really important in combination and not alone. If you're just going to take medication, it's not going to help you. If you're just going to do these things, it is going to be effective but not as effective. But when you combine all of these things, you are definitely in for results. So this is the video on treatment. In the upcoming video, I'm going to do your diet for PCOD and also go in a little more detail on the contraceptive pills, because they are the mainstay of treatment as of now. If you need more information on these medicines, you can contact us on vectorclinic.com. We will be more than happy to do a consultation for you, a video consultation, and make you some custom plans, a custom diet plan maybe, depending on your situation. And then we'll be more than happy to respond any of your questions as well. We hope to see you soon, and take care as always. Bye-bye.